Hello and welcome back. This is Nurse Eunice with Florida Training Academy, and in today's video, I'm going to be showing you how to perform perineal care on a male resident. Let's talk about our supplies. Some of your facilities will require barrier cream. We have our body wash. We have washcloths. I think I have 4. We have 2 towels in addition to a towel that's on the table. I prefer to put a towel on the table. That's not a requirement, but because this is this patient's eating surface, I want to keep it as clean as possible. So that's the purpose of the towel. I have a laundry bag. I also have a laundry basket, which you can't see. It's off camera. Some of your facilities will allow you to use wipes, others will not. So if you're able to use wipes, go ahead and do so. And then if I need to change the pad, I have an additional one. So this is a disposable pad. You may refer to it as a chucks, but beneath the patient right now is a reusable, it's a washable pad. So we'll see if it needs to be changed. And so whenever you're thinking about perineal care, you're always thinking about preventing cross-contamination. So we want to start from the cleanest area and then work our way to the dirtiest area. So it's going to be front to back. Other things you need to be mindful of are body mechanics, so making sure that your bed is up to a working height, which it is, and try not to work over rails. I've already gotten the patient's permission. I've raised the bed. I've washed my hands. I've gloved up. I've allowed him to check the water temperature. If, because of limitations with movement, he was unable to put his finger into the water and check the temperature, I would simply wet a washcloth and then drop some of the water from the washcloth onto his hand, and that would be a way that he can check the water temperature. One more thing that I want to encourage you to do is to encourage independence. So allow your patients to do as much as possible, even if it's not perfect. And so if they can move their extremities, allow them to maybe wash the penis, and then you would take care of the scrotum and the rectum. So here we go. Let us begin. Introduction's already been done. I'm just going to move this over a little bit. Mr. Lucas, how are you doing? Good. I'm going to lay you back. Is that okay? Yeah. And I know you heard me tell our audience that we were doing perineal care, but you may not know what that means. So perineal care is pretty much me cleaning your genitals, your private area. All right. Are you still comfortable? Good. And I like to communicate with my patients and let them know what I'm doing. All right. I'm pulling your cover down. You do not want to overexpose. Something that I prefer to do is to actually put a towel. So if you have a bath towel, that's wonderful. But if you have a towel, you can put that over their genitals. Let's say somebody walks in quickly and they didn't knock. The purpose of this towel is so that I could easily cover my patients. Sometimes family members, they're not medical professionals, so they're just going to do what they want to do, and they're going to come in fast, and I want to make sure that my patient is protected. So are you still doing okay? All right, great. I'm going to open up your legs a little bit just so I can see. All right, so I'm doing my skin assessment at the same time. I'm looking at his penis. I'm looking for any drainage, also checking for discoloration, any different smells that may be abnormal. Whenever you are preparing your washcloth, you're going to, here's a washcloth that's open. Fold it. Now it's halved. Fold it again. And now it's in quarters. And what I do is once I wet it, wring it, and apply my soap, every time I use a different area on the washcloth, I peel a corner back because we should not be using the same corners or the same spots on the washcloth twice. In addition to that, once you've used the washcloth, I forgot about my other item, my laundry bag. Once you've used the cloth, it should not go back into your water because we don't want to recontaminate my water. So we have that right there. Mr. Lucas, I'm going to go ahead and start, okay? Wet it. Wring it. Remember to keep it folded. I'm going to open up my soap. Right. Let me know if you feel any discomfort. I'm going to take the soapy part of my washcloth. I'm going to clean in a circular motion without using the same spot twice. So here we go. Starting at the meatus or the tip of the penis. Go around. And let's peel back. I know a lot of you all are saying, well, Eunice, you only had soap on one spot of washcloth. If you do put too much soap on your patient, That can cause dryness. And if I was, really concerned, I would just put soap on the next washcloth. So far, what I've washed or cleansed is the shaft of his penis. I've not washed his skin folds. I've also not washed his scrotum or his testicle area. You still doing okay? Good. I put some soap on. Make sure that now I'm going to complete that process. And if I get close to the rectal area, I pull back, get a new corner, get close to the rectal area, pull back, get a new corner. And now let me clean his testicles. Don't forget that as men age, their testicles are not nice and firm. They usually start hanging. And so you want to make sure you lift those testicles up because it could be some bacteria, some fecal matter that's beneath. And that's going to cause your male patients to be touching themselves because they're actually itchy. After I wash, I now have to rinse. You still doing okay? Good. All right, so we're going to rinse the same way we wash. We're going to start here at the tip. Try not to touch the bed. I'm going to go around the shaft. We have to remove that excess soap off. Going to go down and change. I flipped it, down and change. Get a new area. Rinse the testicles. And now I'm drying. Make sure you dry thoroughly. Don't leave any area wet because that would be an area where bacteria can grow or yeast can grow. Remember that yeast like areas that are dark and moist. And so I'm going to fold this because I'm going to reuse this towel because I used it after he was clean. And so are you still doing okay? Great. Let's pull back your covers. All right. So that was the front part of the bath. Now I need to actually clean his rectum area. All right. Let's get you to come closer. If my gloves were obviously contaminated, I will go ahead and change them out now. But so far, we're okay. If this was a patient who could move, I ask him to move himself toward me. Before you have a patient turn away from you, make sure that opposite rail is still up. So here we go. I'm going to help you come towards me. I'm going to get your shoulders first. Then I'm going to get your legs. We're going to go this way, okay? You have any pain right now? All right, we're going to turn 1, 2, and 3. All right, you're kind of creaky. Good. If you can hold on to the rail for me. Perfect. Let's not overexpose. Okay, so the towel that I previously had on his front, I'm going to use it to just put beneath him. That way, if any moisture drips, I won't have to change the pad because right now the pad is clean and dry. And make sure it's also wrinkle free. All right, so now that we have him on his side, we're checking on him to make sure he's okay. And so far, we're doing really good. Also, if you have your vital sign monitor, you can be looking at the heart rate, looking at the pulse ox, looking at the O2 saturation. That will help be an indicator also. I did a really good job cleaning from the front because I can see that there is, his testicle area. There is no stool or anything. But now that I have him on his side, I want to go from the cleanest area towards the dirtiest area. And if I need to re-clean those testicles, I could. All right, so we're going to go ahead and clean the rectum area. And so if we had to clean that area multiple times, we'd peel back and then clean again. For a mannequin, that's all he needs for his rectum area because he's not truly contaminated. For a patient, you would use as many washcloths or wipes as you need in order to make sure that their rectal area is clean. So after I clean the rectum, I clean the buttocks. We're going to go up. I'm going to switch back. Clean another area of the buttocks. So now buttocks are clean. Clean area on the washcloth. Clean up. And because I couldn't clean the entire buttock with that one stroke, I'm just going to pull back again and clean again. So make sure that whenever you're doing this, you have sufficient washcloths. I'd rather you bring too many washcloths in the room than not enough. Mr. Lucas, are you still doing okay? Great. I'm almost done. I'm going to rinse you now. And you all should be pros at this by now. So we rinse the same way that we washed. So we're going to go from crack to the back, change positions, rinse the buttock, complete rinsing that buttock, especially if they have a larger or a wider bottom area. Repeat that process here and repeat it again. We don't leave anybody wet. So we're going to dry. I'm going to pat his buttocks. This is a good time to do a skin assessment. So his skin folds, his skin was not impaired. Everything was intact. If your facility required you to put on ointment, you would put that ointment on now, usually on the coccyx area. Sometimes, especially if they have excoriation, similar to like a baby rash, you would put that on, but you'd only do so if your facility or your nurse told you to do. So make sure you follow those policies. I'm going to wipe that off because this is just a mannequin. All right, make sure there's no wrinkles in your pad. Mr. Lucas, I'm going to help you lay back now. Going to discard of my gloves. Going to wash my hands or sanitize my hands. And now I can finish getting him repositioned. We like to leave our patients in the center of the bed. So the way that I move somebody who's unable to move themselves is I move their body in increments. So you do not want to pull a joint because you can dislocate that joint. So I'm going to support both shoulders. I'm going under and I'm moving him over. Reposition his pillow. Make sure his hips are aligned. Check his feet. This will be a good time to elevate the feet if needed. And because most patients do not enjoy laying flat, I'm sure you don't either, I'm going to make sure that I raise the head of his bed back to his tolerance. And if you cannot reach over the bed without touching the linens, you would need to walk around. So I'll walk around and finish the other side. But before I leave, I need to raise the side rail. All right, let me know when you're up high enough. That's good. All right, here's your call bell. Team, great job. So we have provided perineal care to Mr. Lucas. And so now you'd have to, of course, re-glove because you have to clean these supplies. And so you'd be emptying your water basin once you rinse it, and you can clean it with soap if that's what your facility requires. We usually dry it. We don't want it air drying. So you're going to dry it out, and then you're going to take your laundry away. Right now we have a laundry basket. We can put everything there. Our bed is a safety issue because we raised our bed up to a working height. We need to lower that before we leave the patient. Don't forget to leave him with the call bell. See if he has any other needs before you exit the room. My side rails are up. Clean up your room, and don't forget to document. If there is something that you found that was concerning, you notify the nurse, and then in your documentation, you'd also put, what that concern was and that the nurse was notified. So I hope you learned a lot. All right. And so I look forward to seeing you in the next video.